Okay, I think it's better. Hey guys, and welcome
Okay.
back. Welcome back to my channel. Sorry for the technical difficulties that I had at the start. I hope you can all hear me. Let me know in the comment section if you can. And fingers crossed, this live stream goes ahead as normal and we don't run into any more difficulties. But yeah, welcome back to my Ultimate Live University Guide live stream series. And today we're going to be doing something slightly different, but very, very interesting. I'm going to be talking to a nurse in the NHS, and we're just going to be talking about all things nursing, all things healthcare, and hopefully we'll try to answer some of the questions that you guys have. So without further ado, I'm going to introduce you guys to my amazing guest, and she will kind of tell us who she is, her story, how have you been. So yeah, go for it, Zara.
Hi, Fran. Yeah, thank you for having me. I'm so excited for this. I think the audio is a little bit low though on your side. So I think
Okay.
maybe it just needs to be turned up just a little. But yeah, no, thank you for having me. I'm so excited to be part of your series.
No worries. Honestly, it was so amazing getting you on board because I know you're a nurse and like you must be so busy. Like just before we started this live stream, you were talking about how you did a short 8 hour shift, and I was just like absolutely blown away because that's not too short to me.
Yeah, I mean, I think busy is this is just what's normal for me. So like when I say it out loud, other people are like, no, that's crazy. I'm like, yeah, 12-hour shifts is our norm, and short hour shifts is about 8 hours as well. So yeah, it's all about finding balance, I think, with the nursing and then with the personal life, and it takes some time to do that. But yeah.
For sure. So, kind of, what was your story about deciding to do nursing? Was it something that you always wanted to do? And if you can kind of summarize, how was your university experience?
Yeah. Yeah, so I think how I got into nursing, I've always said like I don't have this like childhood experience of when I wanted to be a nurse or anything like that. No, I actually had no idea what I wanted to be as a young girl. And I think at the moment when I had decided to pursue nursing as a career was actually when I was 18 and deciding what degree I wanted to study. So I picked A levels completely unrelated to nursing. So when I first started A levels, I picked subjects that were more maths, politics related, nothing to do with what I'm doing now. And as I was studying my A levels time, I was on a track to pursue economics and politics. That was actually what my UCAS application was for. So very different to what I am right now as a career. And it was actually in the summer of my A levels that I had decided that I did not, as much as I loved politics and economics at the time, it wasn't something that I wanted to do as a career.
Mhm.
So I had a really big decision to make because university is, I guess, that time where you decide who you want to be and what career you want to take. And it's a very young age to decide that because some people are still figuring it out later on in their life. But 18 is quite a lot of pressure, and I didn't know what I wanted to be. All I knew was I wanted to do something that felt meaningful to me.
Yeah.
And I didn't find that in the degree that I had originally applied for. As
Mhm.
much as I enjoyed it, it was, the commitment. Like, do I want to do this as a career? And so I made the decision to actually withdraw my UCAS application on results day. I thought, okay, I'm not going to do this just, yeah. So
That
I
must have
withdrew
been
it.
so hectic.
And I just gave myself a bit of time. And then that's when nursing came up. Did a bit of research into different careers, and nursing was one career that just kept coming up. And I actually found that degree in clearing because obviously I withdrew my application. And so I was thinking of other options. Like, oh, should I take a gap year? Should I take a career break? Should I do an apprenticeship? What should I do? And then nursing was there, and I thought, okay, this looks interesting. I read into it. I asked a few people I knew, and I kind of just went for it. And the only recollection I had of nursing was actually based on this one memory that I had at 15 years old. And that's kind of what gave me the push to, okay, I'm going to apply for this degree. And when I was 15, one of my family members was actually very poorly in hospital, and like a terminal case. So there was a lot of palliative care input involved, a lot of family coming together. And I was very
Yeah.
young at that age, like 15, didn't really know what was going on. I just knew my family member was very sick.
Yeah.
And of all the healthcare professionals that I remember, I just remember the intensive care unit nurse. And I remember how she was smiling. I remember how she just loved what she was doing and caring for my family member, who is a stranger, right, to her. But
Exactly.
everything that she
Exactly.
did, I admired her. And I think that stayed with me for a long time. And it was only when I was deciding, what do I want to become? I thought of her.
Yeah.
I still remember her face. And that's it. I went for it. And then, yeah,
Now
that's how
you're
I got
here.
into nursing.
Now you're here, qualified nurse, doing such an amazing job for, the
Yeah.
NHS and the country. That's so amazing to hear. I'm sorry to hear about your family member, but it's so beautiful that even in kind of the darkness of that experience, there was still light, and that was through the kind of the healthcare professionals at the time, namely the nurse that you
Yeah.
interacted with. And it's just so amazing. And I think these experiences are so vital, because a career such as nursing, or in my case medicine, is not something that you do when
Medicine,
you're
yeah.
at sixth form, so you don't actually know what it entails. So things like work experience, things like having interactions, whether you visit the nurses or the doctors, because if you or another family member, are really, really important, because you get to see it in person, what it actually entails to be a nurse. And I think there's a certain beauty
Yeah.
of coming from the patient side. And yeah, I guess the question to you is, in medicine they put a lot of emphasis on getting that work experience, so you get to see what it's like from the doctor's side as well, the realities of working. Is that something that they look for nursing as much when applying to do it?
Oh God. You know what? This is a really good question, but I went into this degree with zero experience. No healthcare experience
Really?
whatsoever. So I guess the right answer would be yes, try and get as much experience as you can, but it's not the end of the world if you don't have the experience. However, I would strongly recommend, if you're going to put forward an application for nursing, don't do what I did and kind of not have the experience. Um, when I went for my interview, I was actually questioned on this. You're applying for a nursing degree, and what clinical experience do you have going into this? Because every experience or work experience that I had was related to like children or teaching or politics or maths related, because that's what I originally applied for. But nothing actually, I've never worked in a hospital before. I never knew what a care assistant was or anything like that. So on the interview, that was a very specific question they asked me. What experience do you have to be a nurse? And what I did instead was I let my passion for nursing speak for me, because whilst it is important to have experience
Hmm.
and it looks good on an application,
Yeah.
when you're in a role such as medicine, such as nursing, these are professions that are founded on principles like care,
For
that
sure.
you are caring for people when they're at their sickest, and you can have all the experience in the world, but if you're not able to understand the principles, the core principles of your role, that will show. And so for me, I let my passion for being a nurse speak for me. And yes, I did say, yes, I don't have the clinical experience, but I am willing to learn. And it's not like I'm not aware of the challenges that are involved. I welcome those challenges,
I
essentially, and I
welcome.
let that speak for me.
Yeah. I was going to say that's such
Yeah.
like a
Um,
classical ending to the personal statement. I included it in my own as well. How like I welcome all
Good.
challenges that the degree may entail.
Excellent. So I guess to answer your question, I think definitely get the experience, because what happens if you find that it's not for you, but at least you've tried it, because some professionals are not for everyone. You got to know it to try it. So I would say get the experience. It looks stronger on your application. However, think about when we think about nursing, medicine, physiotherapy, pharmacy, we're dealing with people, we're dealing with people's lives. And that will stand out more in an application when you really make that connection. And yeah, I would say that there's more to it than just 2 weeks in a GP clinic or 2 weeks working on a gynae ward. It looks great, but there's more to it.
Amazing. Thank you so much for your answer. And like, I'd love to like just speak to you forever, but like the questions are piling in. So I think we should get started with a lot of them. And a question that's not on my screen, but I remember being sent in, was one by Big Tony, which asks, are there many men who do nursing? Do they sometimes feel alienated, especially as it's such a woman dominated profession? Like, what's kind of been your experiences as working in nursing?
I think that's a very interesting question because I think nursing has a stigma attached that it's just for women. And I strongly say that is not the case. This profession has developed into being very much gender balance, I guess. You've got men and women working in this profession and they love what they do. I think it has time. I think there was a point where you would associate with nursing with a female profession, especially because when we think of nursing, we think of female figures. We think of Florence Nightingale. We think of all wartime heroes who were nurses as women, midwives as women, but we don't associate that as men because it's not spoken about enough. But I think give it some time, it definitely will be spoken about more. And I think the stigma of it being a female dominated career is slowly disappearing. And I certainly disagree with it anyway.
Amazing. And what kind of would your advice be to like any kind of men kind of watching this live stream who would be interested in nursing, but say were kind of put off by the stigma that's
Yeah, so like
attached?
thinking, you've looked in.
Oh no, no, I didn't say anything. I'm sorry. I think there's a lag in the audio. Can you hear me?
Oh, it just cut off just a little bit. Could you
Okay.
just repeat
Okay.
that?
I didn't say anything else after it. I was just like, oh, can you hear me? Ooh.
Oh, okay. Okay, so to answer the question of the anyone who's watching this and thinking, okay, I want to go into nursing, but oh, is it just for women or is it just for girls? No, I think kind of going back to what I kind of originally said, that if you are passionate to do something, go for it. And if you're thinking in the back of your head, oh, I don't want to do that because I don't want people to think that I'm a boy going into a woman's profession, I will say this right now. When you enter into the profession, when you are qualified as a registered nurse, no one's going to look at you as, oh, you're a male nurse or, oh, you're a female nurse. They're going to look at you as a nurse who is looking after them. And that is what the essence of it is, really. You're there to do your duty, and your gender does not define you in doing that. Nursing is a separate profession, just how being a doctor is, just how being a physiotherapist, just how being a lawyer is, if you go outside of healthcare. And yeah, nursing in itself, if that's what is your calling, go for it. And don't let that thought of, oh, I'm a man or I'm a woman stop you from doing that.
Yes, absolutely love that. Thank you so much for your answer. And moving on to the next question that was sent in, and this was sent in by Crystalline. They ask, what made you want to become a nurse and not under the profession? I assume not under the healthcare profession.
Okay, so what made me want to become a nurse? And the second part?
And not under the healthcare profession.
Oh, okay. So I think for me, nursing is like a profession where we're very much at patient care. It's very heavily focused on that. We are the healthcare professionals who stay the most at the bedside with our patients, and it's a very hands-on career path to take as well. So if that's kind of like something that you want to do, you like to be busy, you like to interact and engage with others, then I think that is what was speaking to me as being a nurse. Like, I liked that aspect to it. I liked that I could build a relationship with my patients, not just 15 minutes in a day, but actually 12 hours in a day. Like you can really build some really good working patient-nurse relationships. And I think that's really unique because a lot of the time you'll find that other healthcare professionals, for example, like medicine, you know, you guys go on your rounds in the morning. You're looking after so many patients, and a nurse, you're looking after 6 patients for your entire shift. So there's a difference in that. So you'll find that that's quite unique. You don't really get that kind of exposure, I feel, with other professions. That's what was speaking to me. So yeah, I guess that's why that's the one that hit the light bulb when it came to the healthcare professionals. So yeah.
Absolutely love it, and it's just so amazing to see you kind of so passionate about it and loving your job and everything you do. And yeah, the next question sent in by ACVELO asks, what was it like dealing with COVID-19? Kind of in the middle of the pandemic, what was healthcare like?
Oh gosh, this is a very broad question. I think the first thing that I can say is it was a very tough time. I think it was something that was very overwhelming. I was put in a position in my career that I had never anticipated, and I think that's what also contributed to it. There was a lot of unknowns, a lot of unanswered questions, and of course, dealing with something that was very deadly. And yet, as a healthcare professional, they use the word frontline a lot, and at times it did feel like that because we were going front on with something that the entire world was still trying to understand. And that was very overwhelming, and there's a lot of risks involved. You hear on the news a death toll is involved, and where you go to work, there are people also who are being infected by this and are dying because of this. And so during that whole COVID time, it was probably one of the hardest shifts I had to work. Some of the most rewarding shifts I worked as well. But I think it was something that I'll always remember as a learning lesson, and always as something that, I'm just glad it's over.
Yeah.
Well, it's still ongoing, but that peak time when it was when it was first new, I think there was so many emotions involved that we just had to get on with it. And yeah, it was tough. It was a tough time.
Yeah, I guess just kind of on behalf of like everyone watching this live stream, I'm sure they agree, but like just thank you to you and all like the other amazing frontline staff who were kind of working so hard kind of to help the community, to help those who were infected, and also to help families, because your role as a nurse, I imagine, is also to, not only help the patient but also speak and interact a lot with the families who are kind of involved as well. And like as you said before, like standard shifts for you were like 12 hours long, which just seems crazy to me. So yeah, just kind of on behalf of everyone on the live stream, just kind of thank you for your work. And
No, I really
we're probably
appreciate that. That's
all
very kind
happy.
of you.
We're all happy that we're on the descending part of the curve when it comes to COVID. Ah,
Yeah,
honestly, it was
let's hope so.
definitely
Let's keep it that way.
unprecedented times, as old Boris Johnson would say.
Yeah.
His favourite thing to say. Right, so the next question sent in by Didi Modi is, how long does it take to become a nurse, and briefly explain what your course structure looks like?
So the great thing about nursing is there's so many different routes to actually now becoming a registered nurse. The traditional route was, I guess, kind of what I did, which was A levels / college. You apply for university, and then you do an undergraduate or a postgraduate, undergraduate degree, which is 3 years to become an adult nurse. If you want to go into pediatric nursing, that's actually a separate degree, and that's also 3 years.
Okay.
If you want to go into mental health nursing, that is also at least a 3-year undergraduate as well. Before my time, they used to do general nursing. So actually, it would be a 4-year nursing course, and you would do all of those specialties. But now if you are applying for a nursing course, you need to decide if you want to become an adult nurse, a pediatric nurse, or a mental health nurse. Which is quite, it's just how the UK system is. So one route is to go through A levels or the BTEC route into university, and you would do your undergrad. Of course, there is postgrad as well, so you can actually become a nurse with postgraduate entry or graduate entry as well. And they've actually launched new initiatives called the Nursing Associate Program, which I think is a fairly new thing. It's been around for, I think, 2 to 3 years now, so it's still like building its reputation. And it's aimed at people who have been in healthcare for a very long time, and you can basically be on a pathway to becoming a nurse through a hospital. So the hospital will actually fund your education. So that is another route, and I think it's a 2-year course as well. So yeah, there are different ways, and I'm sure there's another way as well that I can't think off the top of my head. But university via A levels and so on is not the only way. You can actually do other routes, and a big one is access course. So I didn't actually know this. This is something that I learned through my course mates. But you can do a access course specifically for nursing or for midwifery, and that is if you're someone who knows they want to do nursing. Okay, I just want to become a nurse. I don't want to think about what I want to become. I know I want to do that. So you can apply for the access course, and through the access course is when you would apply for university through that, because you do need to go to uni to become a nurse. You need a degree to do that.
Okay, amazing. And kind of like following on from that, what is your standard kind of course structure like?
So my structure, I'll speak on like from my own experience. Every uni is a little bit different.
Yeah.
But you have 3 years, which is 50% theory or university and clinical simulated practice. And then you have 50%, which is placements, because we need to, in order to become registered. So I guess for doctors, you've got your GMC license.
Yeah.
Whereas for nurses, we have our PIN, our nursing PIN, which is basically giving us the degree. That's basically giving us the license that we can practice our profession. So you need to do 2,300 hours of placement clinical hours in order to get your PIN, in addition to passing your assignments, your OSCEs, your exams, and so on. So it's 50% uni, 50% clinical placements. And in your 3 years, you can have blocks. Okay. So you'll have placement blocked, you will have exam periods, you'll have holiday periods, and so on. So every uni is a bit different, but that is the general structure for a nursing degree.
As you were talking, I was trying to calculate what would 2,300 hours look like, and I just can't get my head around it. That is a lot of hours that is needed, but I guess makes sense because, we're going into such kind of a clinical job, such like a hands-on job, so experience is kind of key. And I guess kind of comparing the course to my course, which is medicine, and seeing the variability that exists between different types of universities, there's a lot of differences. For example, one of them being that at certain universities, such as mine, there's like a preclinical, clinical split. So in the first couple of years, we'll just be learning the theory. So we'll be learning the anatomy, the biology, the chemistry. And then in the last couple of years, it's just clinical placements, OSCEs, which are clinical exams. And I was wondering, does that kind of distinction occur in certain nursing kind of courses, or is it standard across universities?
I think it's a standard because we do it at the same time. So we will have a balance of placements and the theory side within the year. And what we try to do is, depending on what year you are, your placement will be kind of suited according to that. So for example, if you're in your first year, it would be very unlikely for you to have a placement in intensive care unit, because you would probably not know what you're doing at all. So that would be more suited, or like an A&E placement.
Yeah.
So you would only really have those placements in your final year as a nursing student once you've built those core skills. And then in your first year, you'll most likely be placed on like an award where you start building those hands-on personal care skills, those like observation skills. So it will go according to what year you're in, which is a really good thing. And yeah, I have had discussions with like a lot of F1s who have now started their rotations, and it's very strange to like they will say openly like, oh, like this is the first like we do placements part of your degree, but this is the first time like you are actually like this is a job now. This is it.
Yeah,
We're doctors
yeah.
now. Yeah, and it's a difference. And I always think that I think that's a really good thing about nursing is you kind of do it together. So it's not
Mm.
such a shock when you then do go into the placements.
Yeah,
So yeah,
it's quite
good balance.
interesting because I was just having a meeting with I think he's an FY3, so he's on his third year foundation training as a doctor, and he's going to be on the
Yeah.
another live stream in a few weeks' time. But he was talking about how
Yeah.
during med school, in the clinical years, when he was doing some of his placements, he absolutely hated it because I mean I've done a few work experience placements. When you kind of don't know what you're doing or you don't really have the skills to be
Yeah.
helpful, and you're more of a burden to the other doctors that you're shadowing, it can seem as though like you're just an irritant to everyone, and you're just hanging around not knowing what to do. And he was saying that's what
Yeah.
it's like as a med student, having not had the training or the skills to be handy. And he said that he hated his clinical years. However, when he actually graduated and it became more like a job, as the FY1s are telling you now, he absolutely loved it. He said it was 1,000 times better.
Yeah.
And I thought that was really, really
Yeah.
interesting because it's not something that you get told in med school. And I remember on my work
Yeah.
experience placements just feeling so like useless, which is normal because I've never learned any of the skills. I'm not qualified. But yeah, it's quite interesting that you say it's like it's not as big of a shock for nursing because you're doing it as you
Yeah.
progress with your degree.
Absolutely. Yeah. It's not a big of a shock, and I think that's a good thing about it. And actually, like just like as like maybe a pointer, but I knew this one doctor who, for that same reason that you just said, because they loved the clinical side to being a doctor. And what they used to do was like whenever they were like on break or they had a weekend, they would actually be an HCA, so a healthcare assistant,
Nice, nice.
and that way earning money because
Hmm.
you are doing a job, but actually you learn a lot about the ward-based care. And even though yeah it's a very big difference to being a doctor or like a med student, but you're still like you're building that patient contact. You're not going to be afraid to like do a wound dressing, for example, or
Yeah.
to put a pressure cuff on, because these things that I've been through it. I've been through it. I'm like, oh my God, how do I take someone's temperature? Am I going to hurt them if I put it in the air? And then it takes practice. So don't worry, you will once it comes to practice anyway. But I have seen some doctors who actually, because nursing students as well, we do that in our we also become we do HCA work, bank shift work, and that's a great way to build your clinical skills and get
And make
paid
money.
so
Yeah,
much.
exactly. Exactly. Absolutely love it. And it's quite interesting because I was talking to another student on a live stream about gap years who originally she was rejected from medicine, but during her gap year, she took the time to like get more clinical experience as a HCA, a healthcare assistant. And she absolutely loved it. She's still working 4 years later. And she said exactly what you said. Like it's a really good way of getting that clinical experience, gaining that clinical
Yeah,
confidence as well, whilst making some sweet cash. So definitely a
yeah,
good thing.
and it's flexible because you pick your shift as well.
Exactly,
So
exactly.
yeah, absolutely.
Cool. And yeah, oh, we're gonna have to like rush through these questions because there's so many questions being sent in, which is absolutely amazing. Next one sent in by Diddy Modi again asks, "How is your lifestyle as a nurse?"
Oh,
Big
my lifestyle as a nurse.
yes.
Oh gosh, how would I describe? Okay, let me describe it in 3 words. Um, I would say organized. I think I'm a bit of an organized
You are definitely
person,
organized, and I
but
loved it.
I'm not an OC. Like I'm spontaneous as well. That's gonna sound so strange. I'm like a organized chaos. That's how I describe my
Hmm.
lifestyle.
Nice. To be fair, you were so organized when it came to collaborating on this live stream. You were literally messaging me, when do I need to do this? When do I was like, yes, this is so great. Like, You were doing like most of the
Hey.
pool work for me.
Oh, amazing. Yeah, I would say organized chaos, where I leave a bit of room to allow things to happen the way that they do, but not like letting it spiral out of control. So I like to know what I'm doing, but I like to leave a little bit of a room to let it happen. And I think that's how my lifestyle is. So like if I have to do something, I'll be like, okay, I know I have to do that, but I don't know yet how I'm going to do it. So I'll figure it out when it's in front of
Figure
me,
it out
that
when we
sort of
cross
thing.
that bridge. Absolutely love that, and I really like how you said like you leave room for spontaneity, because I can imagine working in
Yeah,
healthcare where you don't know what case is gonna like just pop round the
yeah,
corner. You need to be ready for all kind of things, and you can't kind of just stick to this
absolutely.
rigid kind of expectation that everything's going to be the same every single day. And I guess that's a really nice thing about healthcare, that it's not the same every single day, and it keeps you on your toes almost.
Yeah, yeah, absolutely. Yeah, I think that's true. I agree with that.
Cool. Right. The next question, which is sent in by DJ, and I think you've already touched upon it, but just for people who join the live maybe a bit later, what kind of A levels did you take?
Oh gosh. So my A levels, for anyone who's tuning in, was completely unrelated to nursing. So please do not think these are the A levels that you need to take. So I actually took maths, government and politics. I did business, and IT as well. So all unrelated to what you should actually traditionally pick as A levels for nursing. So yeah, that is what I picked to answer the question.
Definitely unconventional, but like now that you're a nurse and you've kind of got through nursing school, you're there. Do you look back and think that the skills you learned with these unconventional subjects are have came in handy at one point in your life?
Oh, absolutely. For example, maths. You will need maths wherever you go. And nursing is
Trying to avoid that.
definitely there as well. So, for those of you who are like, oh, let me go into nursing, we don't have to do any maths. Oh, you are in for a big shock. Because you are going to have to sit a drugs calculation exam where you have to achieve 100% in that exam if you wish to pass it. So yeah, you definitely need to have a good command of your math skills for sure, and you'll need to use that throughout your career as well. I still use it. Yeah, I've got a calculator with me at all times when I'm doing my meds rounds, when I have to do IV medications. I use it a lot in intensive care unit. You're literally always looking at numbers. So maths, absolutely. Politics was more so like my fun subject that I took. I just loved learning about politics. And I think, yes, you need to have a good understanding of governance when you're working in a profession like nursing, because it's still an organization. The NHS is still a very big organization. So you learn those skills. And yeah, everything else is just like I just picked. So yeah, yeah.
Cool. Yeah, I hope that's answered your question. And another question also sent in by DJ Bao is about how long the nursing course is. We've already covered it, but we could always cover it again. And is it similar to medicine? So if you kind of want to quickly briefly summarize how
Yeah.
long nursing courses are.
So nursing, as an undergraduate, with whatever specialty it is, pediatrics, adult, or mental health, will be a 3-year undergraduate degree. It That's the standard. And if you wanted to do a postgrad, so let's just say you did a different undergrad and then you wanted to pursue nursing as a postgraduate degree, that's traditionally 2 years. So it's kind of like just a condensed version of the 3-year course. And I think in comparison to medicine, there's a very big difference because I think it takes you have 5 years of like undergrad as a traditional, right? And then you do
Yeah,
your foundation years
yeah. So
as a
five
doctor.
to
So
six years
at the end
in
of
some
three
cases.
years, you're a nurse. You have that title as a nurse.
Yes.
And yeah, so I guess it's a quicker career path in that sense. Is that the right way to say it? Like
Yeah,
there's
yeah,
less
true, true.
shorter degree.
Yeah. And you also have to think in terms of finances. This shouldn't limit anyone at all, but if kind of you were debating between the two, it is a factor to take into consideration. But I'm not entirely sure. But I think for medicine, in the clinical years or last few years of your degree, I think you can apply for funding by the NHS. So that does kind of help alleviate kind of the cost of tuition fees and stuff like that.
Yeah.
Um,
Yeah.
but yeah, I guess a related
Yeah.
question sent in by Diddy. Modi asks, where did you do your nursing degree? Again, just for anyone who's just tuned in now.
I did my nursing degree in London, City University. So I've studied in the UK, and I did it at City University. Yeah.
Cool. And yeah, this one that is going to be sent in now is a really interesting one. And Diddy asks, is it true that nurses do more in terms of patient care than doctors? And I guess you've kind of already touched upon it beforehand, but if you like kind of want to elaborate as to what your experiences have working alongside doctors
Yeah.
in the multidisciplinary team, keyword for the personal
Yeah.
statement.
I think I'll just like reword it a little bit different.
Yeah.
All the healthcare professionals have contact with their patient, but I think with nurses, we are at the bedside a lot more than other healthcare professionals, because every other healthcare professional, let's just take one patient for example. The amount of healthcare professionals that are involved in that person's care is vital. Even the pharmacist who comes and sees a patient is vital for the medications. The doctor who is coming on their rounds for the diagnosis so that they can plan the care. Then you've got physiotherapists. If you are post-operative and you have a physio who's coming in every 15 minutes to help you, that's all part of it. So I would say everyone has important patient contact according to their profession. Nurses stay at the bedside of the patients because we are attached to wards. We're not attached to patients like a doctor would be or a physiotherapist would be. You have a patient list and you go see your patients, whereas nurses have a ward and we stay within a bay and we are with that patient from the start of our shift to the end of the shift. So we work a little bit different. And yeah, so I guess that's how I would word it, that we're at the bedside more than other professionals.
Yeah, thank you so much for that. And thank you kind of for clarifying it because I guess it is a common misconception for people who haven't actually worked within kind of healthcare, and one that I had myself beforehand, that nurses were more of like the caring professionals. But yeah, you worded it amazingly. And I guess you kind of touched upon the importance of that team element and the interactions
Oh,
between
yeah.
all the different kind of professions that make up healthcare. I guess, yeah, could you kind of elaborate on your experiences working within a team? Yeah,
Yeah. So like within a healthcare team,
yeah,
so like with other medical professionals, um, I think the team is so important when it comes to patient care. If you have one member of the multidisciplinary team, and what by that I mean, like I keep using examples for those of you who are not really familiar with it, but like if you think about a patient, you've got a nurse involved, you have a doctor involved, or a team of doctors involved. You then have a pharmacist involved, you have potentially a physiotherapist involved. If this patient has got very complex needs, you're going to have an occupational therapist involved to make sure that they're being discharged safely. And then it goes on and on. There's then even a bigger web behind that. And that's just for one patient. Then think about how many patients are within a hospital. So teamwork is so essential. And I would say my core team when I'm working as a nurse, and excluding other nurses, like I'm just talking about other healthcare professionals, that's a very important team. You know, there's about 5 other people that you're having to work with, and everyone has a vital part in the patient's care. So if one is not willing to work with the other, it's only the patient that's going to be impacted. And I guess someone like myself, where I base my work on providing, I always think about the patient in the best interest of the patient, right? And that's how we need to think when we do our work. And if I find that as a team we're not seeing eye to eye, that's only going to impact the patient. So as long as we maintain our professionalism, then I think we can always produce amazing quality care. So my general impression or things, I guess, working with the team is if everyone's got that same mindset, then that is the best team to work with. But if you have one person who's a bit like doing their own thing, I'll take a doctor, for example, who doesn't inform the nurse that they have changed a medication. So let's just say they've gone and changed the antibiotics for the patient. Now, because they've liaised with microbiologists, and actually this is what's more important for them to fight the infection that they've got on a ward. This is just an example. Now, if the doctor who's just come, grabbed the drug chart, has gone and crossed off an antibiotic and prescribed something new, has not informed me, and then I find out, I go and look at the drug chart and I see, oh, there's a new medication prescribed. What can happen, and this does happen, is if the doctor had just informed me that they have done this and the reason why they've done this, right, that would mean I could go and inform the pharmacist to order this medication in. That means I could educate the patient on why the antibiotics has been changed. And also it means that I can plan my care throughout the day accordingly to that. Because if I don't know that an IV medication has been changed, or maybe they've added something, that could mean my time management has been changed. So if you do one thing, you don't inform your team, it can have a knock-off effect. And that's so important. And I've been in situations where I've actually just said, just tell me. Tell me if there's a plan of care, because it doesn't just mean, oh, you've done your job. There are a whole other team of people who are working with that patient. So that's really important. If everyone's got a mutual respect for each other within the workforce, then we're on a golden star to basically provide the best care for the patient. But it's just really important. Teamwork's essential.
Amazing. And I guess you've also highlighted how important communication and good communication is as well, because at the core of it is kind of trying to optimize patient care. And you've kind of described it amazingly. And yeah, I'm just like, as a future kind of doctor, you're just teaching me so many like life lessons to almost live and work by. So I'm taking mental notes.
Amazing. Oh, I'm glad.
Cool. Right. Moving on to the next question, and we're going to try and like kind of rush through the next call because there's been so many that sent in and we're already at 41 minutes. So next one sent in by Pakistani mom Bisma asks, how is life as an ICU or an A&E doctor?
Okay. I wouldn't know as a doctor, but I guess as an ICU nurse.
Oh, sorry, it said nurse. I don't know why I read doctor.
Oh, okay. No problem. So I wouldn't know about A&E, I'll be honest, but I imagine it's crazy, if I could put it into a simple sentence. As an intensive care unit nurse, I can speak on behalf of that because I've been in that position. I would say life in that role is very different to being on the wards because it's a specialty area. So you now are going into somewhere where you need to now know more details into skills specific for the type of patients you're looking after. And you're going away. So if you've come from a general background, like myself, general surgical background, that's like how I identify as a nurse, as my specialty. Going into intensive care unit, I found that it's going to sound a bit strange. I felt like I didn't know anything because it's a completely new skill set. So these areas, A&E and intensive care unit, are specialty areas. And when you go into those areas, it can feel very daunting. However, with the right training, that fear will very quickly go, and with the right team as well, with the right support. So at first it's very daunting because it's very new and the patients you're looking after, especially with an ITU, are very sick. To describe it, intensive care unit are patients who are the sickest in the hospital. They require one-to-one nursing care. Now think about that, going from a ward where you have one nurse and 6 patients, you're going from one nurse. You can imagine the difference in care you need to provide and how much that one patient needs. So it's much more complex cases, a lot more going on. But I found with ITU, I could do a lot more of the things that I maybe couldn't do on the ward. Like, because you've got so much going on, you're like, oh, I need to do this, I need to do that. You can sometimes like not spend as much time with your patient as you want to. You'd have to think, because you've got so many things. But in an intensive care unit, you start doing things like, okay, let me make my area tidy, or let me make my sheets like nice for the patient. You start doing those things which are more nursing, like makes you just feel more like, okay, yeah, I'm looking after my patient the way I want to, because you've got that one-to-one patient care. So that was the best thing about ITU. absolutely about that. But yeah, the specialty areas is daunting at first, but once you get the practice and so on, oh, you'll be absolutely fine.
Amazing. And it's been so nice listening to your experiences of working in the intensive care kind of units. And as like you were talking, I was just witnessing in like the interaction from the viewers, just a stream of likes, which is just absolutely amazing. And a quick pointer to anyone who's watching right now, make sure you don't leave this live stream without liking it, because that shows me and Zara that you really, really enjoyed the live stream and that we should do more things that are like this. And it also means that the live stream is like more available, and other viewers can see it more when they search it up. So make sure you do that. And yeah, we'll continue on with the live stream and answering your questions. So next one sent in by Ella asks, how are the roles of a doctor and a nurse different?
Ooh, I feel like you and I should basically answer this as we go. So
yeah, let's do it.
I think,
I'll try my best.
shift work is different.
Yeah.
So nurses, if you're working in the ward, you would traditionally do 12-hour shifts. That's it, standard. You do long days, you do nights. Whereas I think for doctors, the shift work is on call or short days.
Yeah.
I think that's basically
I think so as well.
So doctors would traditionally do 9 to 5. Yeah. So doctors have on-call hours as well, which nurses, if you're like a band 5, that's not that you don't need to worry about. You just need to know about your long days and your night shifts. Keep it simple.
Mm-hmm.
So I think the hours are different. That's a big difference. In terms of the workload, I don't know much about the doctor workload, other than they have patient lists and nurses are allocated in wards. I think that's a really good. I'm just talking about hospital. And in nursing, of course, there is a very big, wide, so many different professions within specialties within nursing. Going with that point as well, I think the specialties within both professions are amazing. You can literally, I think wherever there's a nurse, there's always a doctor. Wherever there's a doctor, there's a nurse. So if you're thinking of, medicine has so many specialties, I guarantee you there's probably the same amount of specialties that the doctors and nurses have. So you will not ever think, you will definitely find something that's right for you. Absolutely. And yeah, I think, I don't know, nurses wear uniforms.
Uniforms. True. It can get a bit confusing when everyone starts wearing scrubs though, because like you just can't tell, which is pretty cool. Another difference that kind of came to mind was in terms of maybe like different responsibilities for different things. Obviously, I'm not a doctor. I'm just going into my second year of medicine, so I might be completely wrong. But in terms of the ability to prescribe medication, I know beforehand it was just something that doctors could do. However, to my awareness now, there's been more roles being introduced into nursing which enabled them to do so. So I think, is it the advanced nurse practitioner? I don't know, is it AP, advanced practitioner nurse, or something like that? I remember on my work experience placement, I actually worked alongside one, and that was the first time I'd ever heard of one. But they're introducing more and more roles into nursing which enable them to kind of prescribe medication as well. That was one of the biggest distinctions. And
yeah,
I don't think I can't really think of anything else.
I think that's a good one. Yeah. I think it's, to put it in a nutshell, I guess doctors deal with diagnosis and prescribing, and they set the plan for the patient, and the nurses are very much involved in the care aspect. We kind of implement the plan as well, so we go according to what the doctor has set for the patient, and we're kind of like the ones executing it as well. So for example, wound dress change, right? Okay, that's what we know. So it's like a teamwork, I'll just say, like we work together. So I think, there's a lot of crossover that you can't really distinguish the two, but they're two separate professions in their own right. So yeah.
Amazing, summarized beautifully. And yes, moving on to the next question, sent in by Didi, asks, how hard is it to do and also to pursue a nursing degree? And kind of before you answer that question, I must apologize for the decrease and change of lighting. I'm literally in front of a window, and like the natural lighting is decreasing as well.
I'm going to just switch on my main light now. So
go for it.
right now. So one second. Hi, I'm back.
She back.
Okay. So the question was, remind me what the question was.
How hard it is to kind of pursue and also do a nursing degree. So going back to your student days.
I think that's really individual. Like I can't say it's easy and I can't say it's hard because everyone's so different. All I can say is work hard. Don't 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 compare yourself to others. Don't compare your grades to others because I think the best thing about medicine and nursing is at the end of the day, no matter what your degree classification is, you are still going to hold that title as a nurse and a doctor. And yes, whilst you want to get that 2-1, you want to get that first class honours, trust me, at the end of the day, when you go to employers, they just want to know, have you got your license? Are you competent? Are you able to look after patients safely? And are you able to represent the NHS or wherever the organisation that you're working in professionally? So your grades work really hard. Do not let them define you, but you need to earn them at the same time. So you need to do those late night studying. You need to go and maybe spend those extra time where you want to probably watch TV, but no, you got to study. You're probably going to have to go through those hard shifts and placements and think, what on earth is this? What is this day like? But those are all building blocks into becoming, a healthcare professional. Becoming a doctor and becoming a nurse is tough. They're tough professions. We work very intense hours and we work with patients who are with people. We're working with people who are sick. It's not that's not an easy thing to do. That's a task within itself. So to get to that, it is a struggle, but it's individual to everyone. So I would say you're going to face challenges and you're going to face good parts to it. It's up to you to make it easy for you, but just put in the hard work.
Put in the work, for sure, for sure. Again, you said it amazingly. And yeah, I can definitely kind of second that in the sense that any degree that you do will be difficult. Like, degrees are not easy. Like, you're not paying kind of 9 grand to just get through it easily. And there are going to be days, as Zara said, where you are going to have to sacrifice parts of your social life in order for you to meet deadlines, and that's absolutely normal. And I think what's kind of distinct about healthcare professionals, whether that be nursing, physiotherapy, or medicine, is that at the end of the day, you are going to be tasked with the health of human beings, with people, and that is like a very, very heavy task. And you do need to make sure that you are competent, because if you do mess up, if you do make mistakes because you weren't focusing in that module in school, or you kind of missed it out in total, that's someone's life at stake. So I think that's why it's a little bit more intense in relation to other courses, but I guess kind of the rewards outweigh the costs immensely. Like, you can probably speak more about this, how rewarding your experience has been working as a nurse and seeing all your hard work kind of paying off.
Yeah, I mean, I cried on graduation. So yeah.
Oh,
I think that kind of sums it up. It was that moment when you're like, oh my God, I'm a nurse.
Mom, I did it. Mom, I did it.
You'll feel that way when you become a doctor. You're just gonna be like, oh my God, it's finally happened.
I can't wait.
Yeah. So it will be worth it, but you have to go through it. And I'll be honest, speaking as someone who's a registered nurse now, that's only the beginning. You still got a lot to go. Even when you get that title as a nurse or a doctor, you still got a long way to go. And this is just the building blocks to the career.
Cool. Right. The next question is sent in, asks about entrance exams. Did you take any, and if so, what were they?
Yeah, so like I said at the beginning of this, I applied through clearing. So that meant all of the entry requirements kind of happened in a fast track manner, because obviously it's clearing and they that's just how the process is. But I had to do the exact same entry process as anyone else would have to do if they applied like from the get-go. But mine was kind of like all squished into one day, so it was very intense. And I didn't actually realize that, but I'll just go through the process. I remember it vividly. That's how intense it was just to get a place. Okay. So I had a phone call interview. That was my first thing. And that was essentially them asking me about, I would say about 5 questions to, why do you wish to pursue nursing? Why did you want to come to this university? So why City University? Why adult nursing and not over the other specialties? So just like a quick kind of like, I wanted to figure out, okay, what is this girl serious or not, basically. So I had a phone call conversation, and then I was invited to come for the assessment day. Now, on the assessment day, and we were told we had to bring our formal documents and so on, like, just to prove that who we were. We had to take a maths and English test. So before anything else, we had to do a maths test and an English test. And if you did not pass those 2 tests, you would be sent home straight away. So essentially, and I remember the group that we were all sitting in literally got split in half because some people failed the test.
Start to the end, like once you fail, the offer's kind of off the table.
Yeah. If you could not pass your the maths test that they had, and if you could not pass the English test that they made, you would be sent home straight away. They literally just said, okay, this person goes to this room, this person goes to that room, and anyone who was in the other room was sent home.
Oh, that's intense.
Yeah, it was like some apprentice.
Yeah, exactly. Honestly.
Yeah. So that was that. So I was like, okay. Okay, so we had lunch. I remember it because it was so intense. So you had to pass the maths and English test. So that's about 3 assessments so far. Then we had to do a clinical scenario exam almost. So we had questions, and in those questions they would give a clinical scenario and you would write how you would deal with it.
Right. And not talk out, or like
you had to write. Yeah.
Oh my gosh, that's interesting.
Yeah. So you had to write it. So it was like, okay, I think they called it clinical scenario test. And then we had to do group interviews.
The
group interviews. Yeah. So this is quite intense. So I guess that's individual to different universities. Some universities do 1-to-1. My uni decided to do group interviews, which was very interesting because I think their reason behind doing a group interview is in nursing, you're going to have to interact. So, and it's nerve-wracking, right? When you're in interview, it's the first time I've ever done a group interview, and like your answers are being watched by everyone else.
I can imagine.
And it's kind of like,
that definitely reminds me of The Apprentice. Like, when they're that definitely reminds me of The Apprentice. When they're in the boardroom.
Yeah, and they're calling each other out.
Yeah. Sounds so intense.
Yeah.
Because I can imagine there's that essence of like competitiveness, in the sense that people know that spaces are limited. Everyone's trying their best to outperform, and naturally you're going to have like your alpha males who are talking the most, people who aren't as confident, people who are more timid. How did those dynamics kind of play out? Or was everyone like...
It was very strange. Yeah, it was very strange because I think I remember my group, and actually the girl that I remember I was sitting next to, we graduated together actually. We did have a laugh on graduation day. We're like, oh, look at us now, a couple of years later. But I remember it was there was about 10 other people in that room, and it was just like, I hadn't done it before. I was 18 at the time, of course. So like I was just thinking, oh my God, I haven't even done a proper interview in my life, and now I'm in a group interview with other people, and they're mature students as well. Some of them are a lot older. So that was just nerve-wracking. But again, if you're there because this is something that you want to do, you just got to answer truthfully. And you could tell that that sound a bit strange, but you could tell there were some people who weren't letting their love for nursing speak. They were thinking of these concrete answers, and you could see right through that. And then you could see others who were like, yeah, I've been doing work experience for so long, or I've always wanted to become a nurse. And in those times, they looked really good in the interview. So yeah, after the group interview, we then had a personality test.
Oh, what?
And that was very interesting.
A personality test?
Yeah.
This is
I
crazy.
think they called it an aptitude test. We actually had to take a personality test.
A personality? That is cool. What are they looking for in this personality test?
So I think the questions were literally like, if you were in a situation where, they were testing your...
Is it a bit like situational judgment?
I just answered the questions like, okay, I'll do this, I'll do that, I'll do this, right? They were like, test, I guess, is because nursing is founded on like these core principles, like the 6 C's.
Yeah.
So the questions, now I look back at it, I'm like, you guys are smart. I
Mm.
see what you were doing there.
Yeah.
They're trying to see that you meet those qualities that are expected in a nurse.
Okay.
So yeah, it makes sense why they did that. And the questions, they were like very much like, okay, you're in a situation where someone's very poorly, how would you respond? Do you walk away, or do you go and help them, or do you sit with them? Do you offer that? Those kind of things that you would just think, oh, okay, how is this related to a degree? But it's very interesting when you're actually thinking about it. And I remember there was one girl who actually failed based on the personality quiz, because we all spoke afterwards. She goes, I don't think I did too well on that, but yeah. So I think that's about 5 different elements to getting into the whole nursing side of school, basically. Yeah, so it's a lot.
That's so intense, and it's crazy when you then add that this all happened in the space of probably a few weeks, because it was, you went through clearing essentially.
Yeah.
So it was
yeah, I did this all in one day.
All in one day? What?
Yeah, I did all
okay,
of that in
I'm just in so
Yeah.
much. Because when I compare that to my experiences, it's a lot more dragged out, and so you have a lot of time in between different things. So what you were talking about with the personality test, the aptitude test, it reminds me of a section of the UK CAT, or the UCAT, which is the medicine admissions test, where they test what would you do in certain situations, and do your values kind of correspond with the values that are looked for in doctors. So it reminds me of that. But it'd be so scary to do it in person and speak through your responses, whereas kind of what we have to do is just, it's multiple choice, and we just pick the best option and say how appropriate each of the actions are.
Okay, no, it was like that.
Oh, okay, so you weren't speaking.
Test was like that. It was on a computer.
Okay.
Yeah.
Okay, I thought you were like, you know, there was a physical interviewer asking you how you would respond. Okay. A comment just came in by Clea, who says, personality test, we only had English test and an interview. And I think it's important to clarify that, you know, the process was different for different universities.
Yeah, so I mean, that is just my own personal experience. I can't really, like, I think some universities, especially with things that have happened with COVID now, so that I guess that they've cut out a lot. Like, for example, I doubt they're going to do group interviews. So you might have a phone call interview instead, and you might just be based on that. I think at my time, that's how they did their assessment. Or you might find that when you apply, you might just have the English and maths test and just the interview. You might not have the clinical scenario, or you might not have the aptitude. And maybe because I went through clearing, maybe they did those extra. I don't know, they didn't. No, that was just how City was. That was literally just how City was. I think City is just that's just how the entry requirements are. Every uni is different, and but I think the principles of the maths, the English, the interview will be across the board for every degree. I guess you have to just do those core skills, and then the additional ones is just what I had to do.
Cool. And I'm just like looking at the time and looking at the amount of amazing questions that are being sent in, and obviously we don't want to kind of keep anyone here for longer than kind of 2 hours, 1 hour and a half. So should we say that we're going to get through kind of 2, 3, 4 more questions before the end of the live, because it's already been an hour? How many should we say?
Yeah, I'm happy.
Cool.
I'm happy to do that. Yeah.
Cool. So next question, sent in by Katie, asks, how do placements work? When do we do them? How long for? Do we need to do them during school holidays? I'm a mom trying to figure out my schedule, 6 weeks, summer holidays, etc. with childcare. So this is a very jam-packed question. I guess you can just kind of start talking about, like, what are the structures of placements like as a student nurse?
Okay, so I think the key word that was asked was the childcare thing within that.
Yeah.
So I think that's really important. And just as a bit of reassurance, if you are someone who's got children, or you are a carer, or you have additional responsibilities in addition to your studies, you need to inform your university about that. And they need to know so that they can allocate the placements appropriately for you. And they also can inform the placement providers of your needs. So do not ever think that you've got a lot going on that you're not going to be able to cope. As long as you communicate that with your university and with your placements, then hopefully you'll get the flexibility that you need. Of course, within reason, because you need to meet clinical hours, and it would be very unlikely for you to say to a placement, oh, I can't do weekends. Because you know what, as a nurse, you will have to do weekends. Or you can't say, I can't do every Monday. Um, or every Tuesday. That's going to be very difficult to achieve as a student nurse because you're still learning and you have to adapt to the rota. However, if you communicate that need as early as possible, your university has a responsibility to accommodate for that. So don't feel like, okay, you're being left in the dark, because there were a lot of my course mates who had children and they were balancing childcare alongside their placements. It is doable and you will still walk away with an amazing degree, and that is most certainly possible. I think the other part to the question was like the structure.
Yeah.
Again, that is university dependent, but traditionally placements come in blocks. So you would have, and you should know this at the start of your academic year. You should know when your blocks are, so that way you can plan. So if you had a child and you knew that you've got like a half term coming up, you would know according to your university structure where they've put your placements blocks. And traditionally they come in like 4 week, 6 week, 4 weeks, 8 weeks, and 12-week blocks. The shortest placement I had was a 2-week placement, and that's still okay. You wouldn't ever get like a 1-week placement. They would traditionally come in those blocks, and as long as you know that, find out at the start of the year what your university structure is like, and then that will help you with your structure as well. If you have to work in your holidays, like your summer holidays, that would only be because you have to make up hours. So just stay on top of your hours, kind of try not to fall behind with that, because the last thing you want to do is try and make up hours when everyone else is chilling, basically.
Great answer. And yeah, thank you for answering all the questions that Katie sent in. Hopefully, like, you feel as though you've kind of got the answer to the questions. And if you kind of have any follow-up questions, feel free to contact Zara. I probably won't have a clue about it, via her Instagram page, which is Nurse Zara UK, right?
Yes.
Yes.
Nurse Zara _ UK. Yes.
Amazing. It's in the description bar below as well if you want to kind of follow that through at the end of this live stream. So I think this might have to be the final question. And this is sent in by Pakistani mom Bisma, who asks, how did you deal with trauma, death at work? Does it really affect you? Is it okay for nurses to get emotional? Or are you expected to be an emotionless professional slash emotionless? This is a really good question, and I guess it protrudes not only to nursing, but also like the rest of the healthcare professional kind of community as well.
Yeah, I mean, straight away, absolutely not. You're not expected to be emotionless. If anything, I think this profession teaches you to be empathetic. I think that's the correct word.
Yeah, that's a good one.
You can't be too emotional and you cannot be emotionless. You have to be empathetic. To be empathetic means you try to understand what the person is feeling and sympathetic, and without feeling sorry for them. So that is sympathy, right? We are to be empathetic healthcare professionals, doctors, nurses, everyone within the field. When it comes to death, I mean, this is a very big topic because it's a very sensitive thing. However, it takes time. And you will find through your own experiences as a student nurse and as an adult nurse, your own coping mechanisms. However, what I can say from my own experiences, kind of dealing with patients who've passed away or are within palliative care situations, is as long as you do what you provide as dignified care and you carry out tasks which help that person have a dignified passing away, because sometimes patients who are end of life, they are kind of got a care plan in place, you will find yourself feeling more like you've done everything that you possibly could have done. Death is inevitable, and sometimes when you are working in the hospital, it can take its toll because obviously you want to get your patients better and you want them to go home and be better,
Yeah.
But sometimes it doesn't happen that way, and that can be difficult to deal with. But it will happen, it will improve with your experiences. And as long as you know that as a nurse and as a doctor, you're in a position to help families going through a tough time, and you're in a position to help a patient have it have a comfortable passing away. So if they're in pain, to give them pain medication, or little things like making them comfortable within the bed, or speaking with the family, uplifting visitor restrictions. Those little things that might seem little to us mean the world to the family and to the patient. So go the extra mile, and then that way, if a tragedy did happen, you can walk away knowing you've done your absolute best.
Yeah.
And sometimes that is all you need to do. You need to do your absolute best. And yeah, so it's a very intense, not intense. It's a very tricky one because everyone, it takes time to develop it. I can't give you an answer, and then when you're faced with that situation, it will, trust me, it might go all throughout your head, over your head. So it takes time. So just realize that this does take time, but build steps to build that empathy for the patients and the patient's family.
Yeah, I think empathy definitely is the perfect word. And I like how you drew the distinction between sympathy, which is, having pity, feeling sorry for the patient, as opposed to empathy, which is going that extra mile to try to understand how the patient is feeling. And in a sense, that does require emotion as well. And I think kind of being emotional shouldn't be as stigmatized as it is, because it shows not only that you care for your patient, but you're kind of almost willing to do everything you can to ensure that the best care for them. And yeah, I think it's important to strike the balance between not being too emotional, because emotions can almost kind of cloud your judgment, and there is a certain level of objectivity that you need in order to be an effective healthcare profession. But yeah, I guess it does take time, and I guess as a future doctor, hopefully one day, it is one of those things that is one of my biggest fears. Kind of how will I be like in the face of such tragedy? But yeah, it's quite inspiring and kind of reassuring to hear that kind of everyone goes through it and it takes time. So yeah, thanks for that, Zara. Thanks for that. I guess this live stream has been so long, and I'm looking through all the amazing questions that are being sent through, such as the ones about kind of any tips on explaining to family that you've changed your degree. Abida has asked, what tips do we have for writing essays for university? Do we need to take sciences for uni? Health social care, is that fine? And to anyone watching this live stream, please feel free to just DM us with all these questions, because it will just take us forever to go through all of them. So Zara's Instagram is Nurse Zara _UK. My Instagram account is francesca.x, and I imagine Zara is really busy, but we'll try our best to answer all of your questions. But yeah, I guess we'll call it a day with today's live stream. And yeah, Zara, I just want to thank you for taking time out of your really, really busy day to come on here and to talk to all these amazing kind of viewers about your experiences and answer questions. You've been amazing.
Thank you so much for having me. And yes, like Anna said, just send your messages to me. That is why I have my page, is so that anyone who is a student nurse or is a nurse or anyone in healthcare, you can message me. And I will. It might not be straight away, but I will definitely try my best to answer your question. So definitely send them through on my page. And yes, I will try my best to answer. So definitely. And thank you so much for having me. Yeah, I really enjoyed it.
No problem. I would love to have you.
So yeah,
honestly,
I think it's
it was
very
such
good
a treat.
first experience.
Thank you so much. And I must apologise, I'm progressively getting darker and darker and darker. It wasn't the best idea sitting in front of a window. But some of the comments that we've had sent through are, thank you, Zara. Every hospital needs a nurse like you. which is really, really nice.
Oh,
Sophie says you should both be proud of your choice. Well done. And it's just been so nice kind of interacting with you guys in the comment section, and seeing that support. So thank you to everyone watching this live stream right now. And
absolutely. Thank you, guys.
yeah, and I guess we're going to love you and leave you. Make sure you like this live stream if you've enjoyed our talk and our and check out our social media platforms, which will be in the description bar. Yeah, so with that said, we'll let you get on with the rest of your evening. Have a lovely time, and I'll see you guys in the next live stream. Bye!
Bye, guys.